how I healed my pelvic floor postpartum. My name is Sylvia and I had 2 pregnancies before I have 2 children. I experienced pelvic floor dysfunction after my first pregnancy, and then again when I was pregnant for the second time, I experienced pelvic floor dysfunction again already during my second pregnancy. Actually, I was quite surprised because I remember I was on a holiday and I was only 18 weeks pregnant and I sneezed and then I actually peed myself when I sneezed. My belly was just small. I didn't even have a big belly, so I wasn't even thinking that this is going to happen to me again already during my second pregnancy, imagine. Because I already had a lot of discomfort due to my pelvic floor dysfunction after my first pregnancy, and when it already came so early, I wasn't prepared. I wasn't expecting this. I didn't know why is this happening so early. So in today's video, I want to talk about how you can heal your own pelvic floor and how you can actually go about it and mitigate your symptoms in your everyday life, how you have to change activities or make some modifications in your everyday life, and also during exercise. And we will talk about it at the end of the video, so stay with me till the end. The pelvic floor is actually the group of muscles that is holding together your uterus, your rectum, and your bladder. So when these muscles are relaxed, so it allows you to pee and then to kind of have sex in a normal way. And when you have a prolapse, and then these organs, your bladder, your uterus, and your rectum are actually held up with your pelvic floor muscles, and then they are held in a place. The problem happens when the pelvic muscles that are holding these group of organs, instead of being uptight, they're kind of releasing, sort of, you can imagine that they are releasing or they are weakening, and they won't be able to hold these organs uptight anymore in their place, but they will be sinking lower. This is what happened to me after my first pregnancy. I had a uterine prolapse, which means the uterus was sinking much lower into the vagina, and you have different degrees of the prolapse as well, 1, 2, 3, 4. I had kind of almost like a 3rd degree. It was kind of bulging out from the vagina, so when I looked at the mirror, I could actually see it a little bit coming out. It was pretty scary at the time. I didn't even know what I had to do. I was really scared, what's gonna happen to me. Do I have to get a surgery? I won't be able to get back to my normal life anymore. I was feeling ashamed and embarrassed to talk about it or to tell anyone. Of course, I was telling my husband, but he had no idea what I was talking about. I was also feeling isolated with these feelings because I didn't know who I can talk to or who could actually help me. Because I was feeling ashamed and then I was feeling so much fear, I decided to make sure I'm going to heal myself. I couldn't turn to any doctors or any specialists at the time because I was living in a Caribbean island where I'm not even sure if there is anyone who can actually help in this direction. My midwife didn't even care to check up on me in 6 weeks postpartum, so I knew I was completely on my own. So what I did, I made complete and exhaustive research, and step by step I learned how to mitigate my symptoms, and eventually I was able to put an end to it and actually healed my prolapse. When you have a prolapse, it also accompanies you with symptoms, and the most common symptoms that you can have is pain, heaviness, pulling in the pelvis, pain after sex, pain after walking. You have the feeling of heaviness in the vagina and feel like something is dragging down there or something is coming out of there. Sometimes you can also feel, when you are sitting down, you have the feeling that you are sitting on something, like on a ball. That's what I was feeling. I felt like I'm sitting on a ball, kind of. Of course, it can pair with leak in urine. Maybe you are not able to empty your bladder all the way anymore when you are peeing, so it can cause leaking. And then, of course, it can also pair with back pains, lower back pains, pressure in the pelvis area and the back. At the uterine prolapse, when I had the prolapse of a uterus, I had more of the pain after sex, pain after prolonged walking, pain during walking, feeling like something is dragging down out there or something is coming out of the vagina. I had really these symptoms the first time. Second time when I experienced the prolapse already, that was a bladder prolapse during my second pregnancy. Of course, frequent urination, urine leakage, and this time I was really feeling a lot of back pain, a lower back pain. I remember the worst thing was for me to sit down, and in the seated position I was feeling a lot of pain, and it was very hard for me because I had an office job and I had to work 8 hours next to the computer, which was not possible at all. Luckily, it was COVID time, which means we could start working from home already. So we were already working from home. So obviously, I was not sitting 8 hours. So I did take a lot of breaks. I was getting up. So the sitting, it was really terrible. I was feeling much better when I could actually standing up was also bad when I could walk. So when I was on the move in my house and walking around or outside walking around, so I was on the move, I was feeling okay. But as soon as I stopped and I was in a still position of sitting or in a still position of standing, it was very, very painful in my pelvic area and my back. In most cases, the prolapse is also pairing. It comes together with the diastasis recti. And if you have seen my channel or you are regular visitors here on my channel, then you have heard a lot about diastasis recti because I'm all about it. That is the abdominal separation and the separation of the rectus abdominis, the six-pack muscles, the two muscles that they open up due to the pressure of the belly during pregnancy. And it's just really connected to the pelvic floor because the abs and the pelvic floor are both part of the core muscles, the midsection, the core muscles, so they are functioning together. They have to work together to function well. So if one goes wrong, there is a big chance that the other one is going to go wrong as well. That's why it's very important, heal your symptoms, heal your diastasis recti and heal your pelvic floor, because maybe now you just have diastasis, but if you don't go about it, it might affect your pelvic floor as well and things might go wrong there too, or the other way around. To make it clear, pelvic floor issues and the dysfunction of the abs, the abdominal separation are both part of the core, as I mentioned, which means the reason behind why this happened is of course the pressure of the belly during pregnancy, but also because the core got weakened. Your core muscles in the midsection got weakened during the pregnancy. The obvious solution is to strengthen it back up, because if something is weak, it needs strength. There is no other way. Surgery, I wouldn't say, in some places maybe surgery is an option, but you don't want to go there. Even if you make a surgery, your core is still not going to be strong. Think about that. Even if you get it fixed or by surgery, your prolapse is still not going to change the fact that your core is weak and is not going to strengthen your core. Even if they surgery you, they cannot give you strength. Only you can give yourself strength by applying certain exercises and techniques, implementing them into your daily routine and in your exercise routine. That's the only way. These type of dysfunctions of the core in most cases are very much manageable without surgery, especially if they are just light dysfunction, because as I mentioned, there are different degrees of the dysfunction. The first way to go about it is always the exercise way, the strengthening, to make sure that you strengthen back up your core as it was before, or to make it even more stronger than you were before. These exercises are not heavy lifting, jumping exercises, and these exercises include TVA breathing, so core breathing, pelvic floor tightening and relaxing exercises, which so-called Kegels, strength training, so you have to apply some sort of strength training to strengthen your whole body and your core muscles, and to manage it in your everyday life. So you might need some modifications in your everyday life as well. So let's go about how you can manage the symptoms during exercise. You have to start to strengthen your core. You have to learn how to lift safely, how to breathe correctly, how to hold your posture, how to hold yourself so that is not damaging further your pelvic floor. You would not even think, but these things that I'm telling you are very simple and easy, very obvious things, actually very logical and obvious things. People just don't think about them because they are so simple, and everybody is thinking that to heal your pelvic floor issue is something university level science-based knowledge as difficult thing you need, but actually it's the simple things: your posture, your breathing technique, how you lift, how you walk, how you manage your body and your posture in those situations. You have to learn to engage your core and pelvic floor muscles correctly. You have to modify your exercises according to your need. Obviously now you have to avoid jumping and running exercises, high impact exercises. So these are not good at the moment for now. Later on, as you improve, you can introduce them back into your life, but for now, when you have the dragging down feelings, when you have the leaking urine, when you have all these symptoms, if you apply more pressure to it with bouncing movements, with heavy weight, then it might make it worse, and you might just make it worse for yourself. So for now, you have to stop this and forget this for a while until you are getting better better, and then you can reintroduce them into your routine little by little. How to manage your symptoms in your everyday life is also similar to how to manage your symptoms during exercise. You have to learn how to lift correctly, how to breathe, how to hold your posture correctly, how to walk around correctly during the day with your posture, how to sit well. It's all about the simple things, as I said, your posture, your breathing, how you lift when you pick up your groceries or your child. You also have to know how to do that correctly, because these are in your everyday life. You cannot just say, no, I'm not doing it anymore. You can't stop life because you have a prolapse now, a pelvic floor dysfunction. So this is something that you have to know about. And these are very much sensible things. So you can't even tell me that, no, I'm not gonna do that. These are for your own good to do in order to manage and heal your own symptoms, unless you want to live with your symptoms forever. Also, how to act when you sneeze and cough. If you used to leak during sneeze and cough, it's worth to contract your pelvic floor core muscles and engage those muscles when you would sneeze and cough. You have to change your way how you approach certain situations, like when you pick up something on the ground, it's better to maybe go down on your one knee, or when you go next to your child to explain something on the ground, also go on your one knee. Try to keep your knees and your legs closer together. Avoid positions when you are opening your leg up really wide. When you're opening your legs up completely wide, that's also when the gravity is just pulling down, right? It's always just sensible and simple things that you can do and implement in your life to help yourself, to heal yourself and mitigate your symptoms. So this is the first step, what you have to do in order to identify and go about your pelvic floor dysfunction, your prolapse. I recommend you to watch this video next, in which you can learn how to do correctly the Kegels, pelvic floor strengthening exercises, because these are the next step and these are also very important to do on a daily basis if you want to heal your prolapse. I mentioned a lot of situations, what you can change and how you can mitigate your symptoms in your everyday life or exercise. If there is something I didn't mention, let me know in the comment and I will give you some tips how you have to avoid having symptoms or leaking urine during in that specific situation in your everyday life. If you have any questions, please drop me in the comment. If you have suggestions what you would like to hear next about pelvic floor dysfunction, prolapse, let me know.